grateful to have some time to do a podcast today on English language learners. I am going to introduce who you see here. We have Julie Radford, who is Lead Student Success Advising and Recruitment in our Student Success area at Marquette University. And then we have Taylor Rose Pamperin, who is a Graduate Student Success and Programming Specialist. And then we have Maria Keegan, who is a Nursing Academic Coaching and Program Support Specialist. And then there's me. I'm the Associate Dean for Academic Affairs in the College of Nursing. And so our goal today is really to come together to start the conversation about English language learners. We all have them, and we've been noticing some trends, and we want to share those trends with you all today. And hopefully at the end, we'll share some contact information to start crowdsourcing or thinking about this together, because this affects all of us as we prepare future nurses or future advanced practice nurses. So we don't have the answers, but we hope we can get to that point soon. So we come from a mid-sized private nonprofit Jesuit university in the Midwest. We have about 8,000 undergraduate students, and I'm kind of buffering that. And we have about 4,000 graduate students in our university. A majority of our undergrads do come from public high schools, from surrounding states. We get a lot from the surrounding area, but we do get the different coasts of students. And with our students, majority white institution, we do have 34% in our last year's statistics for students of color. And so since 2016, we've been working towards the Hispanic Serving Institution, HSI status. And when we made that commitment back in 2016, which sounds forever ago, we were at 9.7% of students that identified Hispanic, Latino, Latinx. And currently we're at 15%, so slowly making progress. And I know that everyone on the podcast today is going to talk a little bit about that here and there. And this matters to nursing because we all know that the United States, the demographics are constantly changing. We want to put out professionals that look like the populations they're going to serve. And that also includes language. And so this is definitely essential to help grow the nursing profession to better care for those that we're going to experience, no matter where our students go out and practice and be the difference. So let's start off. Julie, can you start us by talking about what you've been noticing with our undergraduate students, and then maybe we can go to Taylor and Maria, what we've been noticing.
Yeah, that sounds great. Thanks, Amber. So as a team of student support professionals, we're really very much on the ground with students, right? We're hearing what their experience are at the university. We are kind of go-to resources for students that are here in the nursing program. And so what we really started to notice, and this is more anecdotally than anything, we'll get into the data and how that is in some ways problematic in a bit. But anecdotally speaking, we're noticing more of an influx of multilingual learners. So we're hearing from students as well as from faculty that there is more of a need for support for our students whose language may not be English as a first language. And so what we've really kind of learned is that we don't really have a cohesive plan to support our multilingual learners at the college level, especially. And so our approach really has been on an individual basis, right? So what do we know about each student? What does each student share with us? What are we hearing from faculty? And then kind of approaching it from that kind of individualistic standpoint, and kind of figuring out as a rather soloed college or department on a larger campus, well, what are the resources outside of our walls, right? And so what we've really started to learn and see is that we really need to get a cohesive plan in place, figure out what those resources are, and make it really streamlined and easy and less of a bulky process for students to find the support that they need.
Right, right. What about you, Taylor, at the graduate student level? What have you been noticing?
Yeah, thank you. So we have been finding that the data just really isn't there for graduate students. And so I think that that is fairly common among graduate and professional programs that oftentimes that as students have progressed and are now in a graduate program, there's this assumption that if they did it once, they know how to do grad school, right?
Yeah.
And that is just untrue, especially for our English language learners or English as second language students. Oftentimes, it's not just a second language, it might be a third and a fourth language. So, what we were doing was just kind of getting pretty curious and doing some digging on what is actually in play currently.
Mm-hmm.
Some of the questions that we asked ourselves too during these interactions with students, interactions with our fellow colleagues, was do students feel safe to share when they are multilingual learners?
Right.
When is the appropriate time to ask that question? Are we reaching out to the right students at the right time? So kind of riffing a little bit on what Julie had mentioned in terms of data collection, we realized that while undergraduate student data has been collected at the application level and during a first year, first survey type of all-encompassing undergraduate data collection, the data for graduate students hasn't been collected in that way. A lot of it is, to Julie's point, if folks are reaching out, they're having concerns, they're having issues, that faculty are feeling unprepared or perhaps under-resourced, or so the similar level of support that perhaps they may have received in undergrad prior to coming to our institution, that might also be a disconnect. And so through through student engagement, student data, we know that as a transformational institution, we're maybe not living up to our goals, right? We might be dropping the ball a little bit in the last 10 years or longer.
Mm-hmm.
Right. There was that element that when you do think about HSI and you read on HSI, that servingness, that word comes up. And,
Yeah.
you're making me think about that. Like, is that servingness there? And maybe not quite, not yet, if we use growth mindset terms, not yet. So, Maria, you're in a newer role within our college as an academic coach, working really closely with student success, but, you're kind of your thing too, and working with students. What have you noticed to kind of contribute to what Julie and Taylor have also been noticing with their undergrad and grad students, with English language learner students?
Yeah, I think the first thing that I've noticed is in this new role, it's formerly a full-time faculty role. And the first thing that struck me when I switched into this academic coaching role, which is much more comprised of like one-on-one student interactions and really like deep relationship building with students and with small groups of students, was how many of our students are multilingual. And honestly, it shocked me. I think that was something that I totally missed. It was not on my radar in the classroom at all. Which makes sense. I think, we see growing trends of more multilingual students at our institution, but it also makes me wonder how much was I missing when I was in the classroom, because a multilingual learner, and that experience is individual and complex, but they can, present in the classroom as a student who maybe is ill prepared if they're not ready to answer questions as quickly as their peers. They can present as a student who's just not getting it, which certainly is not always the case. But that was the first thing that struck me. The second thing that struck me, kind of as I'm building these individual relationships, is just like how diverse the experience is for multilingual learners. It's not a one size fits all. So I have plenty of students who feel that it affects their academic performance or their academic experience, but they're not necessarily struggling in their coursework, or they haven't identified that being a multilingual learner is affecting struggles. And then I have students who certainly are identifying, like, yes, I know that this is impacting my academic performance. So definitely not a one size fits all. I think big picture, the thing that I think about is, we do want to be a transformational institution. We're thinking a lot about inclusive course design and inclusive, transparent course design. And these are conversations that we've been having for years. And once I started identifying that I'm seeing many more learners who are multilingual, who are English language learners, like, where do they show up in that process? Is kind of the big question in my head.
Mm-hmm. Mm-hmm. I could spend a whole podcast just on transparent design. For those of you listening that aren't sure what that actually is, transparent design is a framework developed by Marianne Wilkelmes, Suzanne Tapp, and Allison Boyd. But transparent design is about giving students the purpose of what you're having them do, what knowledge are they going to gain from that activity, and then specific tasks that they need to work through. And a task could be frustrated, struggle with this, and then the criteria in which they're going to be assessed. And so it really levels the playing field for all students when they don't have to spend so much time and effort trying to figure out what is it that my professor wants from me. Mm-hmm. So there's a little side note on transparent design. But I think that funnels nicely into this conversation, though. And so that's kind of the what behind what we've been noticing at our institution. So let's get into maybe some of the so what. Why does this matter? So Julie, what are you thinking about and why this all matters? Why do we need to be spending time on multilingual learners or English language learners?
I think that's really the question at the root of this, right? And I think that involves such a cultural shift of the mindset that we tend to have in higher ed, right? Which is students are accepted to our higher ed institution. They need to be coming with the equipment and the knowledge and the tools to be successful, rather than the mindset of what can we do to be supplying those things for our students? How can we build structures into place so that students are not floundering and trying to figure this out on their own, right? So when we talk about being an emerging HSI, that's a wonderful, wonderful goal. I love that we are pursuing the HSI status at our institution. But I think the tougher part outside of recruiting those students and having those students come to our institution is really supporting those students, right? So giving the opportunity without the resources in place for them to really succeed, it's not quite fair, right? So we need to just kind of raise that bar for ourselves, I think, and really walk the walk by having those kind of robust support services in place for our students. And, going back to that idea of like a cultural shift, I think that, it's important to keep reminding ourselves that multilingual students are coming to our campus with so much knowledge, right? So many strengths, not only for our institution here as students, but as future nurses, right? So what can we really be doing to kind of change to a strengths-based mindset in terms of these students? And not only, meet them where they are and support them, but figure out ways to really uplift them and change that culture around so that we're saying, oh my gosh, we are so lucky to have you here. What do you need? Right?
Right.
Celebrating that. Absolutely.
Yes. Like I've had students that walk away from their first anatomy and physiology class feeling a huge weight of imposter syndrome because As many listeners might be aware, that class is going to be very vocabulary heavy,
Yeah.
right? So that's one small example of like, how can we set students up before that first A&P class so that they do not leave feeling like they don't belong?
Right, right. That's really great points. That cultural shift in mindset really stood out to me because in nursing education, a lot of times there's that saying, you know, think like a nurse. You're just going to learn to think like a nurse.
Yeah.
And it's like, well, wait a minute. When are we actually teaching them what that actually means? What does that look like? And how do we work through that? And I think it's taking that intentional step back to think through, how do we actually do this? And then if you think about it from your perspective with the English language learners, that cultural shift in mindset, I think, follows the same exact thing. Yeah.
Yep.
Taylor, what about you? What are you thinking about more of your graduate side of the house, of the so what in all of this?
Yeah, I think that there's a lot to be said, you know, to sort of jump off of what you're sharing, that our students are bringing with them this lived wisdom, this cultural knowledge, these perspectives, just like our, you know, we are a PWI, right? A predominantly white institution. Right. All folks are coming with their understandings, their lived experiences. We should see that as abundance, right? We should see that as something that's really to be fostered and to flourish. And when we sort of, you know, eliminate the humanity of things, like you're saying, Amber, we lose the richness that nursing can be, right? And right. How we're able to educate nurses and send them into the world to serve people, all people, right?
Yeah.
So a lot of the research that we've been doing, we started with a lit review. At the same time, we were doing, you know, kind of outreach to colleagues. So in combination of reaching out to my grad school colleagues, my, you know, fellow student success colleagues that work with graduate students, we realized that a lot of information was sort of owned in-house or collected in a silo. And so that's number one. A huge area of the so what is, how do we foster and create and sustain student success resources if we're all doing it in kind of micro dosing student success, right? So how do we prepare and provide student success strategies and resources at a larger institutional level if that information never really gets there or isn't really available? So that's kind of number one. The second piece is, you know, through the lit review, we're seeing a lot of literature recommend or suggest that we put that full force of accommodations behind accommodations of all kind, right? So not only for testing anxiety, not only for other types of, you know, mobility restrictions, and, you know, providing that resource to students who are English language learners. I think this ties really closely to what Julie is saying, that we need to embrace the students that are here, and we need to feel really the gratitude that they chose us, not the opposite way where we're asking them, just kind of jam yourself into this mold that we have, you know, I think higher ed in general has been perpetuating for many, many years. So for example, when students come to us, like I mentioned with a previous degree, we don't know what kind of support that they've been provided at other institutions. It might have been really robust. It might have been really poor, you know, poorly done. So when English language learners receive referrals to disability support services or to other type of, you know, offices that offer accommodations, it can feel insufficient. And what's the message that we're sending to our English language learners?
Mhm.
Rather than identifying accommodations exclusively through something like a disability services or support services, the opportunity to sort of approach accommodations in a truly holistic way.
Yeah.
And that's what really ties to then the other piece of, why is this important? We are a Jesuit institution. We've committed to caring for the whole person through our commitment to Cura Personalis.
Mhm.
This must include celebrating lived wisdom, differences, and approaching those differences as an asset. So not only encouraging and providing accommodations, but understanding that we should foster that pride in multilingualism, that in order to reach that goal, we really need to examine the referral process, how things are communicated, and that perception of what are accommodations for, who are accommodations for, because for a very long time, there's been a stigma, and is that necessary, and is that direction that we want to be moving?
Mhm.
Right, right. The point you made about, we're forcing students into our mold, and we're doing that not only in higher ed, because I do agree with you, but also in the nursing profession. And
Mhm.
Taylor, at one point you shared with me the word like professional or professionalism is rooted in white supremacy. So we have to think about what is that?
Yeah.
And when we think about the nursing profession, how are we helping to support students to be their authentic selves out in practice, to be the best nurses they can? And Maria, I think, do you want to share a little bit about kind of your so what of getting students out? Like, what are you thinking about getting them out into practice?
Yeah, I mean, I think you said it really well, but I was a practicing nurse and nurse practitioner working in the hospital. I as always with pre-professional education and professional education for nursing students, like there is that other stakeholder. And I'm thinking about that when I'm seeing patients, because this is not just, and of course it is, do the right thing by our students, and as educators, that is front of mind, right? And I'm thinking about a student that Taylor and I shared who was a multilingual learner and just brilliant, and was referred out to disability services for accommodations. And she, wisely drew issue with that and said, in no uncertain terms, I wonder if we could perhaps do a little better here. But I think she was really a catalyst for us to like start thinking about doing the right thing as a team. And we had a lot of conversations around that. So yes, 100% there is that level. And then also, what about this other stakeholder, which is our patients and their families, and the communities that we serve, and their health outcomes. Because we know, while the research around how do we best support multilingual learners, English language learners is somewhat limited, and certainly limited when it comes to nursing education. Like the research is not limited when it comes to the difference it makes for patients, families, communities in terms of having clinicians who look like you and yes, who speak the language. So yeah, that's definitely always back of mind and sometimes front of mind if I'm out there seeing patients. I'm like, this is, there's layers to this, and it really does matter.
Yeah, absolutely. It's a very complex thing to think about. But I often tell faculty and ask, what's our ethical obligation to our students and our ethical obligation to our patients, and our ethical obligation, I think, as student success, people within our college is what we've been talking about today, is how do we do this better? How are we better about this and more holistic? And so, as I said in the introduction, we don't have answers. We've been doing a lot of thinking and a lot of different things here and there, and definitely want to hear from you all, what you've been doing, what's been working. I think about appreciative inquiry. Let's focus on what's working, because we can be really good at what's not. But Julie, do you want to maybe start with what do we do now?
Right. So I'll talk a little bit about what we're thinking as next steps. But as Amber said, yes, please, the suggestions, the what are you all doing is going to be so, so helpful for us at our institution as well. So Taylor mentioned already, we've done a lit review. That's been really helpful to just kind of lay the groundwork for what knowledge, what's been, noticed and published on. So next steps for us include creating a survey for students that we might send out to our own population of students. Taylor mentioned earlier that some of the data that is out there is a little bit siloed. And on the undergraduate side, kind of self-indicating that you are a multilanguage learner upon application has a lot of implications around, trust in a university or an institution, as well as kind of how is this going to be perceived as I'm applying to this institution. So we're hoping that with our students and in a way that's presented from the student services, student success team, that might be a really trusted engagement and a good way for students to feel comfortable sharing with us. If we are sending them kind of our own survey, we'll kind of bolster that trust and engagement by visiting classrooms to talk about what we're trying to do with this information. And that will be a really good opportunity too, to be in front of students and really kind of change that, start to change that mindset of to like more of a strengths-based and celebrating our multilingual learners. So that's kind of a next step for us. I know Taylor will talk a little bit more about like university-wide collaboration, but that is also on our radar as well. And then just what kind of interventions might be really effective for our students, which I know Maria will get into a little bit too.
Yeah. Maria, why don't you go next with what are you thinking about potential interventions, and then we can wrap it up with Taylor putting the call out.
Yeah, I'm had to get some interventions in place and resisting the urge to do so before we actually collect this assessment data. Like Julie said, we've got plans in the works for collecting some survey data this fall and winter. And we're really excited to see what that shows and excited to see if there is disparity between what's been collected in the past and the way that it's been collected in the past and how we're really hoping to present this in a supportive and safe fashion. But the things on my mind in terms of intervention, do we want to think about implementing a validated tool which exists? They don't exist specifically for nursing that we've seen, but we're thinking about the validated tools that are out there. Do we want to consider implementing that as part of our student assessments, the student success team? Do we want to like Amber was saying, use what works. So like what's working well in other student success projects. We've seen really good success with targeting classes that are particularly challenging that we know by the numbers are like the riskiest, classes for students when they're in them in terms of whether they can progress through the program and continue to be successful. So I've got my eye on those, what we kind of affectionately refer to as like high DFW, i.e. The classes where students have the highest rates of getting D's, F's, or needing to withdraw. And how can we tailor some multilingual learner ELL interventions to those classes specifically, knowing that they're high risk areas? And I think beyond that, one of the things that makes me really excited is harnessing like peer support, faculty and peer support from other English language learners and English language learning faculty, so that we are really lifting up the community that already exists here, that's just kind of been maybe under celebrated until this point. Yeah, those are a few of the things that are front of mind for me right now.
Thanks, Maria. And Taylor?
Yeah. So, just to kind of talk a little bit about what has been successful. So for an example, we're reaching out to my colleagues in the graduate school and in other graduate programs at our institution, getting their feedback. What do you know? How are you collecting data? Is this something that you're aware of being a need? And through that, I was able to work with our graduate school and our colleagues, and we have actually changed our application. So our graduate school application now, rather than asking the question upon application, we ask in an optional way, do you identify as an English language learner or ESL student? Once they are able to accept their offer of admission, that's one of the questions that they can answer. So we try to remove some of that, possible, what are you going to use this for? Why do you want to know? Is this something that you're going to help me and help celebrate? Or am I going to be tokenized? Right. And so that was something that now, regardless of if, programs and other graduate programs were aware of it, they now have this data. We're now starting to collect the data of students who identify and choose to identify with us as English language learners. That's a huge step forward. In addition to that, we absolutely need to collaborate. So this is me giving all of you listeners the opportunity to let us know what has been successful. What are things that you see as aspirational or that you have always wanted to do and think that could be really beneficial, but you also are looking for the data or the literature or the verified tools. There are so many ways that we can work together, and the opportunity to connect across our own campuses, but truly just across the profession. We see such a deep desire to do better and to serve our students better, and are sort of, feeling the rub between helping individual students in the moment and moving our institutions forward with our goals in mind. And so we want to hear from folks. How are things going? Have you had successes? To Amber's point, the failures are good to know, but we really want to focus on what has been positively received by your students, but also positively received by the faculty and staff that support them. So we want to collaborate. So let's do that.
Yes. Thank you so much to Maria, Julie, Taylor. This has been amazing and so thoughtful. Just a very thoughtful and intentional discussion on English language learners. And so we put the call out to everybody. My email is amber.young, Y-O-U-N-G, -Brice, B-R-I-C-E, @marquette.edu. You can definitely email me and I will funnel to the team. And maybe in the future, if this garners a lot of likes and attention, maybe we do something a little bit more, such as a webinar or something a little bit bigger that we can really engage and interact in real time with each other on this topic. So thank you, everybody, for your time and attention today. We look forward to hearing from you. Thanks.